Hello, today is April 16, 2022. My name is Naetzy Ramos, and I'm interviewing Naetzy Ramos for the University Library Special Collections and Archives at the University of Texas Rio Grande Valley, hereby abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Ramos, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview, along with any other photographs and/or documentation you are willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each question. Do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes, I agree.
Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
As you recall, we previously filled out a pre-interview form. We use information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members, so that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
Yes, I agree.
On occasion, UTRGV Special Collection and Archives and Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or email with journalists?
No, I do not agree.
Okay. Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you have to say in the interview questions. I will ask now. Okay. Naetzy, thank you for your time. Like I said earlier, your stories and experiences are valuable to us at UTRGV Special Collections and Archives, and to our partners at the Voces Oral History Center at the University of Texas at Austin. Because you're a member of the healthcare field here in Texas, because of your status of a nurse or a first responder for the pandemic, and your experiences with COVID patients and other nurse colleagues, and because of your status as a daughter and sister, I know you have many meaningful stories and experiences to share on how COVID-19 has impacted those roles in your life. And the way you carry yourself in your life. Before we talk about COVID-19 stories, can you please share with us a bit about yourself? Who are you? How do you wish to be known? Who is Naetzy Ramos?
Yes. Well, hello. My name is Naetzy. I'm a registered nurse. I got my Bachelor's of Science in Nursing from the University of Texas Pan American, now known as the University of Texas UTR, no, Rio Grande Valley. Sorry. I graduated with my bachelor's in 2015, and that's when I started working as a registered nurse. I currently work in Austin, Texas, but this has been pretty recent. Before this, I was working in San Antonio. That's where I was at the beginning of the pandemic. For the most part, I've been a intensive care unit nurse, and then more recently I started doing travel nursing also in the intensive care unit. um, but yeah, that's a little bit about what I do.
Thank you. So this first section of questions asks you to please share your stories and memories from when COVID-19 pandemic made its first impacts in December 2019 to about the summer of 2020. It also, so like the first question would be, um, can you share some memorable stories about how you first heard or learned about COVID-19, whether it was the radio, TV, social media, etc.?
Well, I remember around February 2020, um, getting a lot of like news articles pop up on my phone about this virus and how it was overseas. And before we even got any patients of our own. So it felt kind of strange, because we were here at the hospital and we weren't getting any kind of cases like that, but we were just hearing and anticipating over the news. I remember seeing a lot of like um, tweets and stuff about it too. But it always felt so far away. It never felt like it was something that would hit us so hard.
What were some early reports or rumors about COVID-19 that you remember back in 2020?
Um, I can't think of any reports in particular, but I do remember like they were like listing like symptoms, and it was things that we had had in the hospital since January. We had had a few patients, I would say maybe like two or three, where these reports and what they were announcing that were the like starting symptoms and how it developed. We had seen a couple of people like that, and we hadn't been able to diagnose them because every single thing we tested them for was negative. So then getting these reports in the news about how this new virus and the signs and symptoms and things like that. So we were all kind of thinking like, is this something that maybe these couple of patients had and we just had no idea? So I remember it kind of like had this sense of like fear around the hospital. Well, maybe not around the hospital, but our unit, because it was just in our little section. It wasn't throughout the hospital.
So at what point did you realize the pandemic was a serious life-altering event?
Um, I would say maybe at around mm, just a few months in, really, because everything really changed so fast. I remember when we had our very first COVID patient. It was a young 21-year-old healthy girl. And in just a matter of like a week and a half, we had to transfer her to another hospital to get ECMO because there was nothing we could do for her in our hospital because she was just so sick. And in just a matter of a couple of months, um, we had to open a whole new ICU that was just dedicated to COVID patients, and we were overrun. Um, I want to say by like May 2020, we had three or four different COVID units open in our hospital, not enough staff, and everybody was just freaking out and thinking like, wow, how are we as workers gonna make it through this? And how are our patients gonna survive? Because we had people just dying left and right. It was, like you said, it was serious and life altering.
Do you remember what it was like for you during the stay-at-home orders in 2020? Like obviously you were an essential worker, but like do you remember how it was for other people, or like did you experience any moments where like you're like, okay, should I stay at home? Should I continue going to work?
Well, even for us, it kind of felt very um like I'm sorry, I'm um I felt like the city and the world really was like in a panic mode. At work, they started handing us out these like signed letters that we had to keep on our person, like every time we were in our car, that said we were allowed to be out after a certain hour because we were essential workers. That way, if we were stopped by the police, they would let us like go to work or go home or whatever it was. Um, by the stay-at-home orders, I ended up living with one of my work friends because I had I was I lived alone at the time, and she didn't want to get her husband sick. So we ended up moving in together, kind of as a preventative situation because we were working with COVID patients every day. So we would just stay together to try and close that, um, keep that bubble from reaching other people. So it really did affect us too, even if we were essential workers, as you said, because the only time we would leave the apartment was to go to work and come straight back. It wasn't like because we had a letter from whoever it was, we were allowed to be out later or whatever. It was literally just get home, go to work, and repeat over and over and over again.
And this was while you were still in San Antonio. So I guess over like that time, what news media or social media or other sources did you rely on to keep you informed about COVID-19? And why did you prefer those sources?
It was mostly, I don't think I ever really trusted anything on like social media. Um, Especially because people get really um, panicky and out of hand when it comes to spreading misinformation. Um, I feel like when it comes to my specific situation, we had a little bit of a more organized um, source just because the hospital would give us like articles, and we would have pretty much daily debriefing and morning meetings about what the new procedure was, what the new numbers regarding COVID were. So I think that's where I got most of my information. And by talking to like our infectious disease doctor at work, um, more than I got any information from like the news or social media.
Can you share with me what you understand about COVID-19 as an infectious disease, and how you feel it's impacted society?
Well, COVID 19 is, of course, a virus, mostly spread through contact precautions. So, I mean, droplet precautions. So, just by like coughing, sneezing, talking, any kind of um, secretion that comes out from your mouth like that can spread little droplets. Even just breathing can spread little droplets. And then it can kind of just spread like that. Um, can, sorry, can you repeat the question?
Um,
On
okay.
how it impacted society.
Yes.
So just because it spreads so easily and so rapidly, because like I said, it's just breathing, talking, simple things that you don't even think about. Um, it spreads so fast that it could literally affect anyone. And so when they started with like the stay-at-home orders and the mask mandates, I feel that that's when, especially the mask, is when it really impacted people because a lot of people, one, they didn't understand, and like I said before, there was so much misinformation being spread that it made it even harder for people to understand. And that's when um, numbers grew and everything because of lack of understanding. And I feel like um, maybe um, if things, well, not even, because I feel like it impacted society when it got like politicized because then people like just refuse to believe any kind of information and refuse to wear masks and refuse to do the, I wouldn't say the right thing, but like the nice thing, which is protect your neighbor, protect your even strangers around the street, you know? And I feel like that's how it mostly impacted people. I don't know if that made any sense. I'm sorry.
No, yeah, that makes sense. Um, is there anything that like you still don't know about COVID or that you might like want to know more about? Or do you feel like right now, at least in the early days, you're pretty informed about it?
I don't think we were pretty informed about it in the early days because things were changing so fast. Like every other day, we would like completely strip our like regulations at the hospital and switch what was expected and what was required because the information, as we learned more about the virus, or we had to make all those changes. So it was just so hard to keep up with um, the virus and the precautions and what we needed to do at work. Um, and then things, I guess, we still need a lot more to know, especially with the variants that have developed and like keep developing until today. So I just feel like it's like a never ending cycle of knowing more and more.
Thank you. So this next phase asks you to share any stories about COVID-19 vaccines and any vaccination related stories you may wish to tell us.
Okay,
So let me know when you're ready to move on to this portion.
I'm ready.
Okay. Did you get a vaccine and a follow-up booster shot?
Yes, I did. I've gotten oh, my two vaccines and my booster.
Okay. So what was it like? Was it easy or difficult for you in terms of like scheduling, wait time? Did you experience any side effects?
Honestly, it should have been easy, but it was one of the hardest things for me. I wanted that vaccine so bad, but the hospital where I was working, when it was first starting to get passed out to healthcare workers, wouldn't give it to me because I was not part of their staff. I was a traveler at the time. And so I was not able to get a vaccine for a really long time. And I would cry about it and I would wait. And then I ended up getting it at my next contract. And even then, like I had to beg for that vaccine. I had to email so many people that would just like take forever to reply to my emails. I ended up getting it at the end of my contract. So I got my first dose at the end of March 2021, I guess. Yeah. Yeah, March of last year, I got my first dose, and I feel like it should have been a lot sooner because I knew people that were getting it since like December, and they weren't even, not that I should have gotten it before anybody else, but with direct contact to patients, you would think that essential healthcare workers would be getting it, and I was refused that opportunity.
So did you feel any side effects from your vaccine?
After my second dose, I did get a little bit of a temperature and some muscle aches, maybe a little bit of a cough, but it only lasted 24 hours. Um, and then I was fine. Um, Booster and the first shot, I kind of just had a little bit of a sore arm, but nothing else.
Thank you. So now this next set of questions are going to ask you about how COVID-19 has impacted your life in the way of your career and family. So let me know when you're ready to move on to this portion.
I'm ready.
Okay. Do you feel um, do you feel your family had the same beliefs as you about COVID-19, or were there some members who took it more like seriously or lightly, and how so?
I feel like ever since we started getting information about COVID vaccine, I was talking to my parents about it and telling them everything that I was learning and everything that I was seeing. So I feel like they were pretty um, up to date with the information that I knew and pretty understanding. And like, I don't think they ever had um, any like doubts that I was telling them the truth. So I feel like just because, or mainly because they were getting, I don't know how it would have been like, let's say if I wasn't giving them information like that, but they were getting like something straight from someone that was living it. So their beliefs were pretty in line with mine, which I was very thankful for.
When do you first recall going back home to see your family since COVID started? How did seeing them make you feel?
So when I got to go home, um, I hadn't been home in about like almost a year. It took me to go home because my plan had been to go home for spring break 2020, and then that's when kind of everything started happening. So I hadn't been there since New Year's 2020, I believe. Um, so when I finally went home, I had finished a travel assignment in November and I was exhausted and I decided to take the month of December off. So when I finished my contract, I quarantined for 2 weeks. I took a couple of COVID tests, and then I was finally able to go home. And I just felt relief, you know, to be able to interact with people and like, and knowing that everybody was okay. And so at this point, I don't think anybody in my family had gotten COVID. Um, it was just like relief to be able to see familiar faces and interact with people.
In the pre-interview questions, you mentioned that your parents and brother got COVID. How did that make you feel since you weren't with them at the time, like hearing about them getting COVID-19?
Um, well, when they got COVID, I know my mom and my brother had very mild symptoms. They described it as just a cold. My dad was pretty sick though. He still has like follow-up pulmonology appointments because he still has like some residual um effects from COVID in his lungs. It was pretty scary. Like my mom would call me and she would tell me like, "Oh, your dad's um O2 saturation has been like at 86%, but it's okay. It'll come up." And I was like, "No, if it's not coming up, y'all need to go to the doctor." And they're like, "No, it's fine. It'll come up." I mean, and it would come up eventually, but it was a little bit I don't know. I felt like, oh, I wish I was there to help. But then I was like, I can't be there to help because I don't want to get COVID. Um, and it was just like feeling that feeling of not being able to do anything. Thankfully, everybody was fine. Like I said, he just still has follow-up appointments with a pulmonologist, but nobody had to be hospitalized or anything like that.
How were the first few family gatherings that you went to, like for the holidays or just right when you came back?
I mean, it was nothing like what we were used to in previous years. We had always had like big family gatherings, especially for like Christmas. But that first time I went home after COVID, I believe it was just like my immediate family and nobody else, just because everybody was kind of scared. And I mean, it was the safe thing to do. So it was small and casual, just my parents, my siblings, and my grandma, I believe. That was everybody that was at the holidays. And it was still nice. I mean, I would have preferred that over nothing. I didn't miss like having the extended family, but it was for everybody's best interest to stay home.
Is there anything else you'd like to share about this time?
Um, no, not really. I mean, I think I said pretty much everything.
Okay, so Naetzy, this next portion will be talking about how the pandemic affected the work you do as a nurse. Let me know when you're ready to proceed with these questions.
I'm ready.
Okay, so for some background context, can you tell us what you were doing right before COVID-19 and how long you've been working as a nurse? You kind of mentioned it a little bit in the beginning, but just can you elaborate a bit more on that?
So, I've been a nurse for almost 7 years, next month. Um, I had been working ICU in San Antonio. Um, and I mean, we would get um, a lot of very sick people, mostly like respiratory issues or like um, GI and heart issues at our hospital, but everything was, I don't want to say routine, but we would get mostly the same kind of patient. So everything just felt um, like you kind of expected what you were going to have every single day at work. Um, Prior to the pandemic, I just worked at that ICU unit. It was a relatively medium unit, 24 beds of ICU. Occasionally, we would go to like the telemetry floor or intermediate care just to help out, but for the most part, just staying in my own unit and um, talking to people there.
So, what were your duties, I guess, before the pandemic? How did they change once you started getting all these numbers into the hospital? All these people.
Well, before the pandemic, I was just working as like a regular staff nurse. Um, when the pandemic started, though, we ended up opening a completely new ICU unit. It had already been in the works, but it just wasn't ready. And then when the news of COVID hit, and we started getting like a couple of patients in March, they accelerated that process and opened the new ICU. When that opened, I was sent up there to work as a charge nurse. Um, so what that entails is like scheduling and you're kind of in charge of all 24 patients up there because they have nurses assigned to them, but you are overseeing all the nurses. And that was very, very chaotic. We had, as an ICU staff, I guess, you are usually having like two patients. If they're really, really sick, you'll have one patient. If they're not very sick and we're short staffed, sometimes, rarely, you'll have three patients. When we opened this new unit, every single nurse had three patients that were way too unstable to be paired up with two other patients that were way too unstable. So it kind of changed the dynamic in the workplace because I went from just having my two patients and taking care of them, making sure they stayed alive for my shift, to having to take care of my nurses instead and making sure all their patients stayed alive and making sure they had everything they needed to be able to provide care, which a lot of the times we didn't. We were very short on supplies and things like that. So everything that I had been doing for like 5 years completely changed in the matter of like a month.
How would Okay, so basically knowing everything that you know now about COVID-19, everything that happened in 2020, all the like all the charges you would get and everything you would have to do in like the hospitals that you worked at. Um, I guess knowing what you know now, when you first started like in the medical field, would you have decided to like go through with nursing, or was there another field that particularly interested you?
Honestly, I mean, I don't know if this is gonna make me sound like a bad person, but I think about this every single day. And I always tell like anybody that will listen, like if I could go back in time, I would not be a nurse. Absolutely not. I'm sorry. I need a minute. No.
So, is there, thank you for sharing that. Is there a particular field that you would have wanted to go to instead?
Anything else? Anything?
Okay,
Anything would be better than this.
so I could go ahead and give you a minute, and then we could move on to hospital protocols. That might be a little bit easier. So, just let me know when you're ready.
I'm ready.
Okay, so I'm wondering, because you already mentioned how like your hospital, like the hospital you worked at changed and how
Mm-hmm.
you got like so many patients, but um, how did that affect like your hours? Like did they get longer? Did you have to like work extra days? How did that work?
Um, yeah. So at that first hospital that I mentioned when I was working in San Antonio, um, when they switched me to being charge nurse, I would have to get there like an hour early, and then sometimes I would end up leaving like 2 hours, 3 hours later, that my shift ended, just because like handing over the care to the night charge nurse was a very long process, because a lot of the times, like while trying to give report or while trying to do this, we would have like emergency situations that would just kind of prolong everything. So I was working like at least 14, 15-hour days, and we were so short staffed that they were making us have mandatory overtime. So we were working at least like 5 days a week when we usually work 3 days a week. So that was at my like primary hospital where I was actually employed by the hospital. Once I stopped working there and started taking travel assignments, it kind of varied. The most I ever worked was for one specific company. Um, it was kind of like a it was one of those federal agencies. So it was like with the government um, funds that they were paying for their nurses. So for that company, we were working 6 days a week, um, 12-hour days, 6 days a week. So it's that like 70, 80-hour weeks, kind of. I don't know. Um, and then other companies that I worked for, because I did several assignments with several different companies. Some assignments were like 5 weeks, like that one that I mentioned that I was working 6 days a week. So that one I did 6 days a week for 5 weeks. And then after that, I took another assignment with a different staffing agency. That one was 5 days a week. So I had one extra day off. And then eventually I was like, no, this is too much. I am overworking myself. I need to get something that is going to be more reasonable so that I can have some time off. So that's when I started working like 3, 4 days a week, um, which is still what I'm working now. Right now, I'm working as a local contract person for the hospital that I'm at, and I have a 36-hour contract, like per week, which I end up working 40 hours, but it's that's all I do because I'm tired.
So you would say that you experience a lot of burnout in your field, but
Oh, absolutely.
how would you say that that like affects you, like I guess physically and emotionally?
Well, I do still have a lot of like PTSD from the first days of COVID. Even when because I started going to therapy about it last year, and even my therapist would tell us like, because I've talked about it with other people that also go, um, like what we talk about, she says it's like what a lot of people from like the military talk about, and like the trauma that we had like matches the trauma that people that have been like deployed or whatever have. So I feel like it really impacted me mentally most of all, physically um, as well. Like I was just tired, constant backaches. I wasn't able to go to the gym for a long time because I was working so much. So that also kind of like hurt me mentally and physically. Um, but yeah, I feel like it's affected every single part of my life.
So, I guess you've mentioned some of like the downfalls, I guess, of being a nurse, but I'm sure there were some like of your favorite things like going into the field at like in the beginning. So, could you share with us like what are your like your favorite parts, your favorite moments that you like or enjoy about being a nurse? Maybe not now, but maybe in the past.
I mean, um, I was always I always worked in the ICU, so we always had very sick patients and dying patients. But it was always nice to make like a connection with the patients or their families. But more than everything, like just the people you were working with, like you become a family. Like everybody is friends, or at least in the units that I've worked with, because I mean that's not a common um like, oh, every this happens in every single nursing unit. No, but the nursing unit that I was working at, we were all very close, um, and it was nice. It was nice to have people that understood what you were going through and could relate and you could talk to, which is still nice today. But it, I guess like being staff at a hospital where like you know everyone and you've been there for years, um, you kind of get those friendships as opposed to now that I'm doing contract work because I'm only there for like a few weeks and then move on to some new place. So that was really nice from before the pandemic.
So how did you, I guess, connect with your patients back then? And then how is that different to how you connect to your patients now, especially those who like may have had or have contacted COVID-19?
Well, before, like, yeah, you would have like your patients that were intubated and couldn't talk to you and stuff. But they would eventually get extubated for the most part. Most people do. And then you could talk to them and kind of like tell them like, hey, I've been here taking care of you, whatever. Um, or like their families would be there every day, so you would like have conversations with them, kind of get to know them if the patients were there for a really long time. But during COVID-19, we were people weren't getting extubated. People that made it to the ICU would die, and we would never be able to extubate them for the most part. And so we were just silent anytime we were in a room working, and we weren't allowed to have patient family members come visit. So it was just you and the ventilated patient. And families, when they would like call on the phone for updates, it's just not the same thing because they just want to know exactly what's going on. And a lot of people that would call would be very frustrated because, I mean, we didn't really have time to be calling them frequently throughout the day. If we talked to them once a day, it was a lot, and people were angry over the phone that they weren't getting phone calls from the doctors and that they weren't able to see their loved ones, which is understandable. But I feel like a lot of the communication was just frustration and anger as opposed to before, where it was like friendliness and gratitude.
So, I guess how you mentioned earlier that you saw like a lot of patients and not many of them, I guess, were vaccinated, some weren't, some weren't.
Hmm.
Would you say that, like, have you seen or how like the vaccinated patients had like reduced symptoms, or like if they were still hit like in a similar manner to other COVID-19 patients who like did have COVID but were vaccinated?
Oh yeah. Once the like mass vaccination rollout happened, we were getting anybody who made it to the ICU, pretty much. I would say like 80-90% of the people that had COVID or made it to the ICU for COVID symptoms or like COVID related illness were not vaccinated. Anybody that was vaccinated, yeah, sometimes they would get admitted to the hospital, but they wouldn't make it as far as the ICU. And then as more and more time passed and more people were like getting their second shot or whatever, we would get patients in the hospital with COVID that were vaccinated, but they just happened to get there from like a car crash or from something completely unrelated to COVID. And our protocol is to test every single person that comes in. So then it would be like an incidental finding, like, oh, by the way, you also have COVID. But they didn't go presenting symptoms. Those were the people that were vaccinated. Um, People that were unvaccinated were still showing up, still going to the ICU, still dying.
Did you have any, I guess, like any patients, or did you come in contact with anyone who was like in denial about COVID, whether it be them having it or like just hearing it like, oh, it's not real?
Oh yeah, all the time. We would have patients with like active COVID in the hospital. We're like, no, I don't have it. This isn't real. I no. And like family members too that would be so angry because they couldn't go in the room. We're like, well, you can't because this patient has COVID. And they would be like, no, that's not real. I'm gonna go in the room. And we're like, no, you're not, because this is hospital policy. Nobody can go in those rooms. Um, we had patients that like were about to like get intubated, like, and they would like cry and beg, like, please give me the vaccine now. I was wrong. And it's like, well, we can't give you the vaccine now. You actively have COVID and you need to be intubated. And so it was very like it was a terrible thing to see. Like people were in denial so bad up until like them being there sick, and they were still saying no when it's something that, and it all comes back to what we talked about earlier about that misinformation, um and like it being politicized. Like people were just so far in denial from what they were getting like in the news, or especially like on things like Facebook. And so yeah, a lot of people, even while being positive for COVID, were in denial of it being something that was real.
You mentioned the news again, and like how it got political during I guess the late um 2020, around 2021. There was a lot of protesting due to like anti-mask protests and stuff like that. Were you ever like witness to it, or just the news, or did that
Just
affect
on
your place of work?
um just in the news. I mean, at work, even now, everybody that goes into the hospital has to wear a mask. Um, and like visitors and stuff, there was a lot of people that had to be constantly reminded, like, hey, we need to put on your mask. Hey, when you, once we started allowing visitors, of course, because it eventually started to where we would allow one person in the room. Now we're up to two people in the room, but even now, like, we have to constantly remind people, like, hey, put on your mask. And then an hour will pass by and they're not wearing it again. Please put on your mask. Um, so it's just a constant like cycle of trying to educate people and reminding them like, hey, this is still something that's going on. Because a lot of people even now will be like, Oh yeah, back when like COVID, and it's like no, COVID is happening still now.
So, you mentioned how you never like got COVID-19, but were there any other like coworkers that like may have like tested positive for COVID? And if they did they get time off or how did that affect them, like their working schedules?
Um,
Like what's the protocol for that if you got sick for COVID-19?
so before like 2020, early 2021, people were getting sick left and right, honestly, at work, and it was like a stay at home for 2 weeks kind of thing. Um, so we were even shorter and had to pick up even more shifts to kind of cover for the people that were out sick because we weren't getting new people in, you know? So if somebody got sick and we're out for 2 weeks, that was 2 weeks that we were going to be short a person. Um, Now, I believe the protocol that we have at work is if you're sick, you're gone for 5 days. So technically, like one work week, I guess, because we typically work 3 days a week. So it's gone down to 5 days, and even if you have symptoms, they have you come back to work. Which I mean, I don't think it's great because then we have lunch in the same tiny little room and things like that. So you could get more people sick. But yeah, for the most part, people were getting time off. Honestly, I never had it and I never asked. So I don't know if it was like a COVID paid time off or like if it just came straight out of your own PTO. Um, I'm guessing that's more likely, honestly. But I know for sure people were getting like 2 weeks off at the beginning and now it's 5 days.
Okay, thank you so much for sharing this next like these final questions. It's like the last section and it just focuses on if you have any stories you would like to share about the pandemic and the response by the local, state, and national elected officials. You could feel free to pass on any questions as well. Let me know when
Yeah,
you're ready.
I'm ready.
Okay, so since you worked in different places, you could answer to either San Antonio or Austin, or anywhere else that you worked. Do you feel satisfied with the local response to COVID-19 in Austin, San Antonio over the last 2 years?
I feel like Austin and San Antonio did a great job with the response to COVID. There was a lot of like outdoor clinics and outdoor like testing centers um, that were very accessible to the public. Like you could just book your test for that very day and like go get tested and whatnot. And they're like policies for like stay at home and like nightly curfews were established and things like that. So it was very good. But I did work like in other places where it wasn't. I worked in Midland, Texas for maybe like 3.5 months. And this was like peak COVID. This was like August 2020 till November 2020. And there it was terrible. Um, there was no rules. People were, I remember going to like, whenever I needed to go to like the grocery store, nobody was wearing a mask and it wasn't enforced at all. There was no stay at home like curfews or anything. Restaurants were doing indoor dining. Like everything was like everything was like, oh, nothing, COVID doesn't exist. Um, when they had such high like hospitalization rates. So I mean, and both all of these places that I talked about are in Texas. It's just like people, different communities had different responses.
So what do you think, were you satisfied with the state response? Because again, each local response was different. But what about the state response to COVID-19 led by Governor Abbott over these past couple years?
Um, like what for what? Can you give me like an example of what you
Um,
mean?
yeah, for example, um, Governor Abbott, he like released like these stay-at-home like mandates for Texas, but he also had these like other like open what is it? The when he allowed for Texas to go back to work, that working release order in early um like late 2021, early 2022, like stuff like that. Do you feel satisfied with his responses
I
in the past couple?
remember, yeah, thank you so much. I remember I felt like whenever he started like opening Texas back up, like it was way too early. And whenever he started like when he did that whole thing about like how people don't have to wear masks anymore, um, I personally thought it was not a good move, um, because people still need to be wearing masks. COVID is still spreading. Um, maybe I mean I understand it being more relaxed now, but when he first came out with that, like getting away with a mask mandate and things like that, it was way too soon. We had such a huge spike at work with COVID patients that could have very well been prevented.
What about like the national response to COVID-19? So this would have started with President Trump and like late 2019 till 2020, but then now President Biden from 20 like last year to now.
I feel like, um, I mean, there was a pretty good like response when it comes to like sending out travel nurses to like different states, and like they opened states to where if you because I have my license in the state of Texas. Texas happens to be a compact state. There's like 30 compact states, which means I can practice in any of those states without getting another license. But with COVID, and one thing that I feel it was a really good thing that they did, starting in 2020, I don't think it's in effect anymore. But since it was like a crisis situation, they opened to where healthcare providers could practice at any state without waiting to receive um, the particular state license. Because it's not something you have to like test or anything. You just apply and they'll give it to you. But for the most part, it takes some time. So that was a really good thing that I feel like the government did. Another thing was they were pretty quick at like the step once they were able to test for it, like the test sites and everything opened up pretty quickly. I feel like vaccines were distributed pretty fast too, um, at the end of 2020, beginning of 2021. Um, but at the national level, like the government was still like, especially during like Trump's presidency, um, they were responsible for a lot of misinformation. Like I remember watching like President Trump on the news talking about, um, oh, Clorox in 3 minutes will kill it off any surface. Is there anything like Clorox that we can be drinking and taking care of COVID? And then people were believing that. And we had patients like coming into the hospital demanding to take Plaquenil because President Trump said that Plaquenil was the way to go for COVID. And it's like, no, you don't listen to people on TV. I don't care if they're the president or whoever. Like, you listen to the doctors, not something you just, oh, I saw it on the internet, you know? So, in a way, it was good. In another way, it was very bad. It just kind of depends on like specific and particular things.
Thank you. So I guess this next question is more of a if you had like the power either of political office and if not in political office, like in like the hospitals you worked at, how would you say you would change the response to COVID-19? Would you have done anything differently or
I think it's all about like being honest and being like coming forth with facts to the people, not about like anything else. That's the most important thing. Like if you are someone in a position where you influence things like this, like a political person, like our governor or president or whatever, like you shouldn't bring your opinion into it. Like this is something that needs to be presented with facts that come from like actual medical people and scientists, not from what benefits your political agenda. That's what I feel like should be different.
Would you so like this year it's also a midterm election year, and this November that's when you would be able to vote for like your senators, your congressmen. How would you say that COVID is going to factor into your votes? And are you planning on voting this year?
I am planning on voting. I feel like a lot of our politicians in the Texas government said things and did things that were during COVID that were not beneficial to the public, and that's definitely going to play a part on how I'm voting. Because, like I said, if people are just honest with the people that they represent and come forth with facts instead of trying to weaponize this virus to their benefit their political agenda, then you benefit your people and the people that you're supposed to be representing. So yeah, of course, it's gonna play a very important part of my voting this year.
So what about the following presidential election? Right now we're in 2022. The next one won't be until 2024, depending on how COVID is. But that's still because right now it's sort of like lessening, but there's still certain spikes in areas. Would you say that that is also going to affect like who you choose for president in the 2024 election year?
I mean, maybe it just kind of depends on the progress that happens now. I think there's a lot of bigger issues that would affect my voting on a presidential level than just COVID. Um, but yeah, COVID is still something that is huge, um, and like keeps our lives being affected this way. Yeah, I mean, it will probably play a role in affecting that, but I feel like there's when it comes to like the presidential level, I mean, it's still pretty far away. So I feel like there's so many things that would influence from here to then.
So was there anything in the way of support or assistance that you feel you needed or currently need during this COVID-19 pandemic?
Um, I feel, I don't know how to answer this. Mm,
You don't have to answer if you don't want to. You could skip as well. Or I could rephrase
yeah,
the question.
can we skip? Oh, yeah, I can't really think of anything.
Okay. All right. So, what impact or purpose do you hope that your story may have in the Voices of the Pandemic digital archives?
I mean, um, I just hope that if anybody listens and is able to like relate to the things that I've been through, they know that other people are going through it as well and they're not alone um, in this pandemic. So
Okay.
like
So
to
this
like give,
is.
oh sorry, and just
Oh
to
no,
like
go
give
ahead.
information about like the things that I saw and the things that I experienced for people that maybe have no direct relation to anybody in like healthcare or in or in healthcare themselves, just to get a little inside look.
Thank you. So I guess this would be the final question, and it's just, is there any other information you would like to share with me about your experience with COVID-19 that I have not yet asked about?
Um, no, I think you were pretty thorough with your questions. But I'm open to answer anything else if it ever comes up.
All right. Okay, so thank you, Naetzy, for sharing your stories with me and the Voices of a Pandemic Oral History Project. I'm gonna go ahead and end this session soon, but just like before we go, is there anything that you would want to remove from this interview session that you may feel may do harm in the future?
No, everything is okay. Thank you so much for the opportunity to talk about my experiences. Um, but everything should be okay.
All right, thank you so much. I'm gonna go ahead and end the session. Have a good day.
Thank you, you too.